this evening. My name is Denise. Hi, thank you for joining us this evening. My name is Denise.
And I'm Angela.
And we're here just to talk briefly about insurance verification and the full surgical journey. I am Dr. Joseph's nurse.
And I work for Dr. Akhtar. And we also have Anita, who wasn't able to be with us today. She is our front desk lady. And what we're going to talk about today is who qualifies for insurance or qualifies for bariatric surgery. We're going to touch on insurance verification in that process. If you don't have insurance benefits, we'll talk about self-pay options, possible financing availability, and then just kind of walk you through the journey of surgery.
Yes. So who qualifies for surgery? If your BMI is 40 or greater, or even if your BMI is below 40, but you have some comorbidities as listed here, hypertension, diabetes, or obstructive sleep apnea, you qualify. Depending on your insurance, after you're verified and you have benefits, some insurance companies require 3 months of a medically managed supervised diet, while others require 6 months of a medically managed supervised diet for the weight loss program. You have to have a consultation with a registered dietitian, meet with a clinical psychologist, do a PT/OT evaluation, which is physical therapy or occupational therapy evaluation, and you may possibly need a letter of medical necessity prior to surgery from your primary care physician. Once you come into the office with your initial consultation, me or Angela would take care of those referrals for you.
So in that first step of the process, you're going to speak with Anita. You're going to call in and she's going to take down some information from you, such as your name, your date of birth, a good contact information for you, and your insurance information. From there, she's going to take the time, because it's very time consuming, and we want to save you all time, to call the insurance company and find out what your bariatric coverage is. And if you have full coverage, what that requirements are as far as what Denise just spoke about. Sometimes they have additional, maybe you need to go see a cardiologist and get signed off from them, or
Preliminary, you might need a preliminary clearance,
sleep study, anything like that. Anita's going to find all of that out for us, and then she's going to schedule you for a consultation. If for some reason you don't have bariatric coverage, she'll go over that with you as well. Some plans have an exclusion in the policy, so she'll explain all of that with you, and we'll touch base with that in just a little bit as well. We do have cash pricing, as you can see.
And they do range from $14,000 to $90,000 depending on the procedure.
So there's also options for financing. That's something that is a case-by-case situation, and we would discuss that at that time. So after your insurance is verified, our next step is to get you scheduled for an appointment. Come in and see us.
So you either see Dr. Akhtar or Dr. Joseph, and once you have that consultation visit with your surgeon, you will decide what procedure is best for you. And then from there, Angela or I will send out those referrals you need to complete your process for surgery. Whether it's, the supervised medically managed part, the dietitian, psychologist, and physical therapy.
So
once the insurance criteria is met, you come back in again to see your surgeon for a pre-op appointment. And from there, all of your work that you have done is sent back to your insurance company for that authorization prior to surgery. And then you have your post-op phase, which lasts for about a year, because you come in for your 2-week appointment with the surgeon. Then you come back in 1 month after that, 3 months, 6 months, and then from there either 9 months, and then yearly. In that process too, you are required to have some labs done to be sure all of your vitamin levels are normal and your regular lab values are that are normal.
So then there's a couple things that we like to touch base on as far as the medically managed weight loss. A lot of patients, that's where we catch a hiccup, or where patients are confused about what that really actually means. And that's the longest portion of the process to qualify and get approved for surgery. The big thing is you have to have that, or insurance just won't approve the surgery. So what that looks like is you either through a specialist that we would recommend or send you to, or your primary care doctor, you work with them for 3 to 6 months, so basically 3 to 6 visits, one each month, with one of those doctors about your weight and things that you can be doing to help you start that healthy lifestyle choice prior to surgery, which will make you more successful once you've had your procedure. So once you've had those 3 to 6 months visits, that's the step where then we can submit all of your stuff to the insurance and get it authorized and get you scheduled for surgery. Now, we talked about earlier that there's possibility that there's an exclusion on your policy, and that means Denise is going to explain for you.
So we have had some patients call us back, understandably, after they've spoken to their insurance company and said, yes, I have an exclusion on my plan, but if you say that this is medically necessary, my insurance company will cover. With my experience with this, Dr. Joseph and I have done this for many years. We have found, regardless if it's medically necessary, your insurance company will not cover any bariatric procedures with an exclusion on your policy. We were told by a medical director there's absolutely nothing we can do to overturn an exclusion on your plan. So that's why we offer the cash options if anyone is interested.
So the exclusion basically just means you don't have bariatric benefits, that the insurance company is going to pay for any portion of that surgery or any of the steps leading up or post-operatively. So I guess the question is, are you ready to make a change?
Yes.
What does that look like for you or for your family? If you are interested in the steps in the process and want to come meet us or come meet Dr. Joseph and Akhtar, who are amazing,
Yes.
don't wait, give us a call. Anita's ready to take phone calls tomorrow. She enjoys talking to people. She is a character. So
just have your insurance card ready because she'll need that information with your benefits information, and she'll be glad to call to get your insurance verified. So our number is listed here, 816-254-9292. Thank you so much. Thank you for